So as you can see here, this is 5 acids that you will have to know for your exams are sulfuric acid, nitric acid, hydrochloric acid, okay, oxalic acid and carbolic acid, basic ones that are readily available. So we'll start from sulfuric acid. So what are acid and what are bases? Acid কাদের বলা হয়? Whose pH is less than 7, and for bases it will be more than 7. More acidic মানে তত pH কম হবে, and more basic if pH is more. Like acidic it will be like 1, 2, 3, 4. Bases will be up to 14. Okay. So starting from acids, sulfuric acid also known as oil of vitriol. So from that oil of vitriol থেকে একটা জিনিস মনে রাখতে হবে, vitriolate, ঠিক আছে? Sulfuric acid আর vitriolate. Vitriolate is throwing off acid, ঠিক আছে? Due to jealousy or rivalry, vitriolate হতে পারে. So according to new classification according to BNS, Bharatiya Nyaya Sanhita, so this falls under 3 sections: section 116, section 117 and section 118, ঠিক আছে? So that is for grievous hurt. Okay, grievous hurt, section 116, 117, 118. So what is grievous hurt is stated in section 116, and the severity on all 117 and 118. Okay. So what is grievous hurt? What are the 8 clauses? Emasculation, privation of sight, privation of hearing, dismemberment of any joint, right? Tarpore bodily pain, joints, disfiguration of face and head. So disfiguration of face and head, that is vitriolate, right? Vitriolate. Okay. Acids. So let's start. For acids, it's very easy. মানে পয়জনিং এ সবথেকে easiest part to remember is acids, ঠিক আছে? Almost all the acids are classified into 2 types. First is for mineral corrosive acids and another is organic corrosive acids. Mineral corrosive acids তিনটে হবে. Mineral corrosive acids এ পড়বে sulfuric, nitric and hydrochloric. আর organic corrosive acid দুটো আছে, oxalic and carbolic. Okay, oxalic and carbolic, that is organic. তাহলে এটা মনে থাকলো. So first and মানে most important is writing the identification. মানে এই অর্ডারটা মনে রাখবে, প্রথমে আইডেন্টিফিকেশন লিখবে, যে কোনো পয়জনেরই হোক আইডেন্টিফিকেশন কেমন দেখাচ্ছে. So normally in sulfuric acid it is colorless, hygroscopy, non-fuming, okay, odorless, heavy liquid, non-fuming, ঠিক আছে? এটা মনে রাখবে. বাকি দুটো ফিউমিং আছে, বাকি যে মিনারেল corrosive acid আছে বাকি দুটো ফিউমিং, and this one is non-fuming. Okay, আর colorless ওই তিনটেই, hydrochloric acid, nitric acid and sulfuric acid, all will be colorless. We have these samples in our department. Okay, so that is a part. As I told you, one is fuming, one is non-fuming, right? So non-fuming, there might be little bit of confusion. So anyway, there are tests regarding it, but in a practical way, if we say that, we will tell you what acid it is. Okay, otherwise there are tests to identify which one is which acid. Okay, so that won't be practically possible for your exams, but still we'll tell you which one is one. Okay, so it is colorless, odorless, non-fuming, hygroscopic in nature. Identification এরকম লিখবে. Then there is position in classification, as I told you, corrosive mineral acid. Okay, fatal dose is 5 to 10 ml on average, and fatal period is 12 to 24 hours. So this is the most intense, মানে এটা সবথেকে what you call মানে most corrosive sulfuric acid. Then according to intensity it will gradually decrease, like first is sulfuric acid, then is nitric acid, and then hydrochloric acid. Okay, তো এটা সব intensity সবথেকে বেশি. So mode of action, এ মনে রাখবে two types এর হয়, একটা local and একটা remote. Local and remote, but this acid has only local action. ঠিক আছে, corrosive mineral acid এর local action টাই main. Remote মানে হচ্ছে systemic action, systemic effect মানে late হয়, যেটা organ, যেটাতে organ are involved and other things. So that will be applicable for oxalic and carbolic acid. Okay, যেটা হচ্ছে remote action. But in this mineral corrosive acids, mainly its action is local. Locally corrosion হবে, এটা লিখতে হবে. So in concentrated form it acts as a corrosive, and in diluted form it acts as an irritant, and if it is more diluted it will act as an stimulant. What it causes is coagulative necrosis. Whereas alkalis will cause liquefactive necrosis. So that's a question, coagulative necrosis kothay hoy, liquefactive necrosis kothay hoy. And it chars and blackens skin, and it forms moist reddish brown stain. It converts hemoglobin into acid hematine. এই ফিচারস গুলো বলতে হতে পারে. So medico legal aspects, it is same for all mineral corrosive acids. Okay, same, খালি কমার্শিয়াল ইউজে একটু চেঞ্জেস থাকবে, সেগুলো দেখে নিচ্ছি. বাট দিস criminal use, it is same for all three acids. Hydrochloric, nitric or sulfuric uses, that is criminal use, are same. ঠিক আছে, তাহলে ইজি হয়ে গেল, একটা মুখস্থ করলেই বাকিটা একদম কভার হয়ে যাচ্ছে. So what are those? In commercial use, it is used in artwork to preserve art and all. It is used in batteries. আমাদের ব্যাটারিতে অ্যাসিড থাকে, তাই তো? ওই যে মুভি ছিল কি গঙ্গা জল না কি, দেখেছে? ঠিক আছে, ব্যাটারি থেকে অ্যাসিড দিয়ে ভিট্রিওলাইজ করে দিল, চোখ পুড়িয়ে দিল. হ্যাঁ, অলরাইট. So batteries have acids. Then in cleaners, drain cleaner, cleaning agent, it also has sulfuric acid. So it is widely used in arts and manufacturing of chemicals, battery and drain cleaner. So mostly all these corrosives, mineral corrosive acid are cleaners. ঠিক আছে, এবারে হাইড্রোক্লোরিকেও যাবে, ওটা ক্লিনিং এজেন্টে ইউজ করা হয়. নাইট্রিক অ্যাসিডেও ওই সেম ক্লিনিং এজেন্ট ইউজ হয়, প্লাস মেটালার্জিতে ইউজ হয়. মেটালার্জি মিনস refining of metals or whatever it is related to metals. ঠিক আছে, ওটা ওই বাকি দুটো অ্যাসিডের সময় আবার আরেকবার দেখে নেব. But in general, in metallurgy it is used as cleaning agent. Okay, and in batteries sulfuric acid is typically used. So criminal use common eta. Homicidal, it will be rare except in cases of children. Suicidal, most common, only preferable by women. Okay, accidentally maybe if it is swallowed, as it is colorless, right? So জল মনে করে কেউ যদি ভুল করে খেয়ে নিল, হঠাৎ করে উপর থেকে খেলো কিছুটা গিয়ে, তারপরে মনে হলো ওটা অ্যাসিড আছে, হতে পারে. accidental it may be, but it is rare. Abortifacient, it won't act as an abortifacient whether it will cause corrosion to the tissues. Okay, so illegal যেটা abortion করার জন্য চেষ্টা করতে পারে, but it is not successful and it will cause harm, injury to the locally, to the tissues. Okay, Vitriolage, as I showed you the picture, vitriolage, it can be done. So an acute exposure এ ওই যেটা ওই ভেপার টেপারতে রেসপিরেটরি ডিস্ট্রেস হতে পারে, আর ওই যেটা নরমালি ইন্ডাস্ট্রিয়াল লেভেলে হয়। নেক্সট কামিং টু সাইন্স এন্ড সিমটমস। Signs and symptoms, when you write in your exam, try to imagine a patient consuming acid. ঠিক আছে, তো অ্যাসিডটা প্রথমে মুখ দিয়ে যাবে, মুখ দিয়ে গিয়ে পেটে যাবে, তাহলে কি কি হতে পারে, in that order if you try to picture it, then you can easily write these things. Very simple. First there will be burning sensation in mouth, okay, then intense thirst would be there, vomiting hote pare, kichu erokom khele, irritating agent khele, corrosive agent khele vomiting precipitate korte pare. So color will be brownish black in color. Tongue pude jete pare, tongue gets corroded, and there will be excruciating pain, and it will become like a pulpy mass, pude jacche, pulpy mass er moton mone hobe. Teeth will become chalky white. That is a very important point. So teeth is chalky white. One should write in exam. Teeth is chalky white. And the staining of tissues will be black or reddish brown, usually spillage around the mouth. So I will show you a picture. See this one. Okay. The first picture jeta dekhcho A, seta hocche locally jodi acid pore thake. If the acid accidentally gets on the person's leg or arms, ঠিক আছে, যদি পড়ে যায়, okay, then the second picture B shows accidental consumption by the child. So there is spillage of acid causing brownish staining, right, as I told you. See, the third picture is when a subject voluntarily consume acid, ঠিক আছে, there you can see the gastric mucosa, stomach, mainly that is stomach, how it blackens, ঠিক আছে. So normally it gets perforated and whole of the abdominal cavity gets blackish liquid, পুরোটা blackish liquid এ ভরে যায় এরকম মনে হয়, মানে যতটা যাচ্ছে it will corrode the organs, diaphragm, everything, it will get corroded. So normally we find the stomach in that state. As you can see in pictures C and D, it is common finding, okay. Postmortem e jokhon ashe to ei picture C আর D te jeta dekhte paccho, that is mostly found after opening the abdominal cavity. Fine. Stomach, here you can see PM findings. So examiner might ask you about the PM findings. So PM findings এর স্টমাকের ব্যাপারটা লিখতে ভুলবে না. So normally they might be asking you another question, why the esophagus is maybe spared whereas the stomach gets more affected. So you should state it like the histological feature. So esophagus is lined by which epithelium? Squamous epithelium, whereas stomach is lined by columnar epithelium. So stomach squamous epithelium is little bit resistant to acid, okay. So that's why esophagus is affected. There will be inflammation, then mucous membrane there will be affected, but mostly affected is the gastric mucosa and the stomach, okay, that gets easily affected. So in postmortem it becomes a small contracted, okay, becomes small and contracted, contains dark brown grumous liquid. So in case if the consumption of acid is less, then only that jeta red দেখাচ্ছে ওইটা হতে পারে. In most of the cases, 90% cases, there will be perforation and there will be blackening, okay, মানে perforate হয়ে সব ওই আশেপাশে টিস্যু everything will be black. Abdomen খোলার সঙ্গে সঙ্গে we will find black liquidy substance, everything is black all around the stomach and all, everything is blackish color, okay. So mucous membrane almost detached or easily detachable, eta hocche in if the quantity is less, মানে যদি দেখা গেল 10 to 15 ml diluted sulfuric acid খেয়েছিস, in that cases এই mucous membrane গুলোকে আমরা differentiate করতে পারবো, but if it has been consumed in a amount is more, then এই mucous membrane অসম্ভব to matlab determine where is mucous membrane, where is the muscle, means stomach, everything becomes like a small black mass. কোনো সময় পাওয়াও যেতে পারে না, ফুটো ফুটো হয়ে থাকবে। the stomach there will be perforating areas here and there. Okay, that is a common finding. Okay, so treatment part we'll discuss as a whole for corrosives. Okay, corrosives, mineral corrosives se treatment part একরকম হবে, and organic corrosive এর treatment part আলাদা আলাদা করে বলে দেবো। So for mineral corrosives the treatment part মানে তিনটে অ্যাসিডের ট্রিটমেন্ট একসঙ্গে একই হবে, ঠিক আছে? হাইড্রোক্লোরিক, সালফিউরিক আর নাইট্রিকের ট্রিটমেন্ট পার্ট একই হবে। So we'll begin with the next one, nitric acid. Nitric acid is also known as aqua fortis, ঠিক আছে? Aqua fortis. So examiner might ask you what is the another name, so you should state it is aqua fortis. So it is also known as acid of sugar or acid of sorrel and salt of sorrel. Please don't state that, okay? Because acid of sorrel or salt of sorrel, there is a ambiguity, means এটা oxalic acid এর সঙ্গে related আছে, so it's better you stick to nitric acid or aqua fortis. Salt of sorrel ওসব বলার দরকার নেই। So in oxalic acid I will state why it is what is sorrel. Sorrel is nothing but a plant genus. So it was this oxalic acid was found, means discovered from the plants oxalis, from the genus this plant species থেকে oxalic acid টা পাওয়া গেছিল। So that is sorrel. Fine. So now coming to the nitric acid, first we will write the identification. It is a colorless fuming liquid. So as I stated you, the first one was non-fuming, but this will be fuming. Okay, fuming with peculiar choking odor, means खूब what do you call it, is very pungent, in other words. So it is a colorless fuming liquid with peculiar choking odor. Position in classification will be corrosive mineral acid. Now the fatal dose, earlier it was 5 to 10 ml, now it has increased to 10 to 15 ml. Okay, and the fatal period is same 12 to 24 hours. Okay, so mode of action is all same, it will act locally as an corrosive, and it is same as sulfuric acid, like it will be in more amount it will act as a corrosive, less amount it will be act as an irritant, and if it's diluted more it will act as a stimulant. It is same for sulfuric and nitric. So main part here is you should know, and the examiner will ask you xanthoproteic reaction. What is xanthoproteic reaction in nitric acid poisoning? So that is the most important one. So examiner in viva they will ask you in which acid you find xanthoproteic reaction, or in a alternately the examiner may ask in which mineral acid poisoning there is yellowish discoloration of skin. Direct question, ঠিক আছে, একটু ঘুরিয়ে, in which mineral acid poisoning, mineral corrosive acid poisoning there is yellowish discoloration of skin. So you should state it is a nitric acid poisoning, right? So এতে কি হয়, as it is a powerful oxidizing agent, when the acid comes in contact with the tissue it causes a chemical reaction. So there is formation of trinitrophenol and nitrous oxide, and in that process there is yellowish discoloration of the skin, right, or tissue. So xanthoproteic reaction, fine, nitric acid মনে রাখতে হবে। So it produces deep yellow coloration of the tissues coming in contact, fine, that it is over. Nitric acid ওইটুকুই, বেশি কিছু না, বাকি same features will be same as sulfuric. Very easy to remember. Signs and symptoms same. Okay, signs and symptoms will be same as it is a corrosive. ওই যা যা ওখানে দেখলে ওইগুলোই লিখবে, ঠিক আছে? Medical legal aspects, only the commercial part is will be changing, and that so means criminal portion is be same as sulfuric acid. যা যা ছিল, homicidal rare, then suicidal common by women, and abortifacient it is not useful but may be tried. Accidental maybe, as it is colorless liquid. If it is stored carelessly, children may easily consume it. So all those features you can write by yourself. Memorizing ta otota lagbe na. তো কি লাগবে এতে? xanthopoietic reaction টা মনে রাখতে হবে. What is xanthopoietic reaction? Nitric acid. So commercial use এ কিছুটা লিখতে হতে পারে, যেটা হচ্ছে electroplating, ঠিক আছে, manufacturing of fertilizers and metal refinery, এগুলোতে ব্যবহার হয়. So metal refinery means this nitric acid is easily dissolves metals except gold and platinum. Okay, so to extract gold and platinum, so nitric acid may be used. ঠিক আছে, ওই যেটা তোমাদের ওই চিপ থাকে, ওই যে মাদারবোর্ড, ইলেকট্রনিক পার্টস, ওতে অনেক গোল্ড প্লেটিং ইউজ করা হয়. So those are dissolved in nitric acid to extract sometimes this gold. Okay, gold যেটা কিছুটা গোল্ড ইউজ হয় ওখানে, very less amount. Okay, that completes our nitric acid. Treatment part ta we'll study after these three acids. It will be same. Now comes hydrochloric acid, also known as muriatic acid, right? Muriatic acid, hydrochloric acid or muriatic acid, also known as spirit of salts. Same here, it is colorless, fuming. Okay, তাহলে দুটো ফিউমিং আর একটা নন ফিউমিং. নন ফিউমিং কোনটা? সালফিউরিক অ্যাসিড. ফাইন. So it is colorless fuming liquid with pungent and strong irritating odor. So same, pungent তিনটেই আছে, strong irritating odor তিনটেরই same আছে. In pure form it is colorless gas. So pure form is normally mostly volatile, so we will not get it. So it is normally we get it in a liquid form. So it is colorless fuming liquid with pungent and strong irritating odor. That you will write in the identification part. Position same, corrosive mineral acid. Fatal dose and fatal period. Fatal dose is more, 15 to 20. আগেরটা ছিল 10 to 15 আর তার আগেরটা ছিল 5 to 10. ঠিক আছে? And fatal period is 18 to 36 hours, মানে একটু বেশি. আগে ছিল 12 to 24, 12 to 24, here is 18 to 36. Mode of action. Mode of action ওই সেম মোটামুটি, লোকালি অ্যাক্টিং, করোসিভ. ওই এতে কি হবে? মেইন হচ্ছে অ্যাশি গ্রে ডিসকালারেশন. What is the differentiating? Little bit differentiating is here, there it produces a ashy gray discoloration of the mucous membrane and skin when it comes in contact. এটা একটু আলাদা. Otherwise it is almost same. And as it is fuming, it will cause respiratory problems. ঠিক আছে, ইরিটেশন হবে, রেসপিরেটরি মিউকোসা, কাফে এ হতে পারে, পালমোনারি এডিমা, ওগুলো তারপরে we'll discuss this in acute fumes. So medical legal aspects, first is commercial use. Commercial use, normally it is used as a bleaching agent. Bleaching agent in metal refinery and in normally as a cleaner. As I stated, it is almost used as a cleaner everywhere. And flux for soldering metal. Soldering করতে গেলে সময় সময় ওটা as a flux it is used. Injudicious use, it is used as for erasing ink. Okay, forgery করতে গেলে হয়তো অনেকে ব্যবহার করতে পারে. Alright, hydrochloric acid. So what I discussed about is the fumes, as it is fuming, so it will cause respiratory tract problems. কি হতে পারে? ইরিটেশন, ব্রঙ্কোনিউমোনিয়া, পালমোনারি edema of the glottis, ঠিক আছে? If it falls in the eye, irritation of eye, corrosion সবই হতে পারে। coryza, conjunctivitis, corneal ulcer, cataract, fumes থেকে। Now coming to the treatment part. Treatment for all these three acids, sulfuric, nitric আর hydrochloric এর treatment as a whole common, ঠিক আছে? যেই অ্যাসিডই আসুক common এটাই for these three acids। corrosive mineral acid এর এটা treatment, okay? So it is very easy. If you think scientifically, you can easily write it down in your exams, okay? প্রথমে কি করব? Imagine yourself, you are sitting in a emergency department. So when the patient comes to you of this poisoning, how will you treat? মেডিকো লিগাল পার্টটা একটু পরে যাচ্ছি, আগে ট্রিটমেন্ট কি করে করবে আগে বলো। ফার্স্ট ইউ উইল ট্রাই টু assure the patient, ঠিক আছে? Then you ask about the history, কি হয়েছে, কি করে, কি খেয়েছিলে, কটার সময় খেয়েছিলে, এগুলো জিজ্ঞেস করতে হবে। কি খেয়েছিলে, কটার সময় খেয়েছিলে, আর কেন খেয়েছিলে, 3 things, when, where, why, huh? At least somebody will bring, accompanying person will be there, right? And if he or she is not able to, then also you have to take it in a manner. She may write or no, likhte to pare. In a very bad scenario, if he or she is illiterate, then it's a means normally will not get that scenario, okay? Fine. So as what do you call, the amount is very important. বেশি অ্যামাউন্টে যদি খেয়ে থাকে তাহলে তো সে তো মরেই যাবে, okay? If it is in less amount, he or she will be able to give the history. So in half an hour, if the patient, মানে patient বললো যে আমি এই কিছুক্ষণ আগে খেয়েছি, ঠিক আছে? Then what will you do? You will try to neutralize by giving plain water or milk, ঠিক আছে? You will never give any base, কোনো বেস, ঠিক আছে, বেসিকে দেবে না, because it will cause reaction. Acid base reaction will cause exothermic heat generation হবে. So it is always avoided to give any base, okay, because of risk of exothermic reaction, which will lead to more damage. So first of all, if the patient comes early, you will first give milk or water to neutralize it, okay? Not neutralize মানে ওর অ্যাক্টিভ মানে ইন্টেন্সিটিটাকে কম করা, ডাইলিউট করা। Then there is demulcent drinks, like ওই যেটা বললাম, milk, olive oil, melted butter, but melted butter, mineral oil, starch water you will not get in emergency. What you will get in emergency is water, okay? Water পেতে পারো। So in case if there is corrosion, যেটা ও বললো যে if he is not able to speak and all those things, so tracheostomy can be done to what do you call, airway rescue, and steroids can be given for stricture. So any acids will cause damage, so damage হলেই stricture হবে, perforation হবে, stricture হবে। So if there is to avoid stricture, we can give steroids. Steroids টা যদি তাড়াতাড়ি শুরু করলে আমরা স্ট্রিকচারটাকে অ্যাভয়েড করতে পারি। স্ট্রিকচার যদি হয়ে যায়, if there is stricture, the patient will have lifelong problems, okay, regarding eating and all, ঠিক আছে? There will be narrowing, food will not pass through, so we have to perform surgery. So steroids are very essential. So if you give steroids, you should give antibiotics, okay? Antibiotics has to be given if you are giving steroids, as স্টেরয়েডস কি করে? ইমিউনোসাপ্রেসেন্ট। সো ইমিউনোসাপ্রেসেন্ট স্টেট will invite microflora. So to subside that, antibiotics are given. Then if the corrosive agent has been dropped, মানে যদি শরীরে কোথাও পড়ে থাকে, means in skin এর ক্ষেত্রে you have to wash it. Okay. Previously we are talking about ingestion. Now we are talking about means locally if it falls on the skin and all. So skin is washed, okay, with water and soap water. Sodium bicarb, magnesium oxide, এগুলো ব্যবহার করা যেতে পারে। And antibiotic ointment, mupirocin ointment or what you call যেটা বার্ন কেসেসে যেটা নর্মালি ইউজ হয়, সিলভার নাইট্রেট, তাই তো, সিলভার এক্স বলে আসে। ওকে, দ্যাট ক্যান বি ইউজড। আইজে যদি কন্ট্যাক্ট হয়ে থাকে, সো ইউ শুড ইরিগেট the eye with water, copious irrigation about for half an hour. Okay. Nutrition jodi if the esophagus is affected, then you have to give parenteral nutrition. Okay. And you have to give analgesics. So what are the types of shock? Hypovolemic shock, cardiogenic shock, distributic shock, neurogenic shock আর septic shock. So এটা distributive এ পড়ে normally, ঠিক আছে? So there is one thing called neurogenic shock. So intense pain may cause shock. So it is always try to give analgesics to relieve the pain. Okay. Correction of circulation, circulatory and symptomatic treatment. Fine. এই এতটা লিখতে পারলেই মোটামুটি চলবে। ট্রিটমেন্ট পার্ট বোঝা গেল তিনটা অ্যাসিডের, বিকজ there is lot of literature about it, but in exam you won't get time to write more. So this will be enough. If you come across other literature where you find it interesting, you can write. Okay, it's not an issue, but these are the bare minimum one has to write. Now coming to the next one, oxalic acid. So now we are left with two more acids, oxalic and carbolic. So oxalic, কটা পর্যন্ত লেকচার আছে? 10টা অবধি আছে তো, so we'll cover it, no problem. So oxalic acid or acid of sugar, also known as acid of sugar. So oxalic acid, it is identification এ কি লিখবে? It is white transparent prismatic crystals. ঠিক আছে, oxalic acid is available in our department, so chances are there it will appear in exam. Okay, oxalic acid, white transparent prismatic crystal, position in classification is organic corrosive. Earlier it was mineral, now the term has changed to organic. So carbolic টাও organic হবে, oxalic টাও organic হবে. Organic corrosive acid. Fatal dose is more, about 15 gram on an average, and fatal period is less, 1 to 2 hours. So it is very dangerous. Mode of action. Earlier all the three previously we learned was local action. Now there is local and remote. Local mane it will in more quantity it will act as a corrosive, and remote, if it is consumed in less quantity, it will have systemic effects, that is remote actions. So same, large amount it will act as corrosive, less amount in irritant, as well as it will have remote action. So remote action e ki hobe? It will react with calcium. Blood এর serum এ calcium থাকে তো, so it will react with calcium and it will form calcium oxalate. Okay, so there will be hypocalcemia. Fine. So that is the most important part, underline kora ache dekho. It reacts with calcium in the plasma and precipitates insoluble calcium oxalate and gets accumulated in liver, heart, lungs and kidneys. So it will cause damage to the organs, right? Renal failure hote pare er jonno, তাই তো, রেসপিরেটরি প্রবলেমস, লিভারের প্রবলেমস হবে। So other part is it will cause hypocalcemia. As hypocalcemia তে কি হয়, there will be muscular কি হবে, টিটানির মতন হবে, তাই তো। So first thing you will write about is the মানে দুটো জিনিস হয়, ক্যালসিয়াম will go down and calcium oxalate, এই দুটো যেন মনে থাকে, এর রিলেটেড বাকিটা লিখতে পারবে ইজিলি। ওকে, so accumulation of calcium oxalate crystals will produce necrosis of renal tubules, মানে এটা হচ্ছে কি renal failure এ যাবে। So necrosis of renal tubules, cloudy swelling and hyaline degeneration of kidney. Okay, আর it will damage the skin and all corrosive mucus, এগুলো তো normal common. Okay, now coming to the calcemia, hypocalcemia. Hypocalcemia তে কি হচ্ছে, it will cause spasm of the muscles, so upper limbs muscles, ঠিক আছে, যেটা হচ্ছে Ashoners hands, then there could be Trocheus sign, okay, and Chostek sign, সব হচ্ছে ওই ক্যালসিয়াম কমে গেছে বলে যে সাইন্স গুলো আমরা পাচ্ছি, স্পাজম হচ্ছে, তো এইগুলো সাইন্স এন্ড সিম্পটমস এ লিখতে পারবে। and there will be excretion of oxalate crystals in urine, okay, that is known as oxaluria. তো oxaluria লিখবে আর হাইপোক্যালসিয়ামিয়ার ফিচারস গুলো লিখবে, ঠিক আছে, তাহলে হয়ে যাবে মোটামুটি। ডায়াগনোসিস কিভাবে করবে, diagnosis is demonstration of oxalate crystals in urine, okay, that will be monohydrates or dihydrates and are shaped like envelope shaped crystals. So like in exam, for exam purpose reverse way te question form করা যায়, যে এরকম ইউরিনে আমরা এই পেলাম envelope shaped crystals, they will write it envelope shaped crystals were found on microscopic examination, এরকম পাওয়া গেছে। So what could be, so it will be oxalic acid poison। আসে হচ্ছে ওই প্ল্যাব রিলেটেড, যেটা কেস সিনারিও প্রেজেন্ট করে, প্ল্যাব এন্ড ইউএসএমএল ওইগুলোতে রিভার্স ওয়েতে ফ্রেম করে কোশ্চেন। ফাইন, ক্লিয়ার। নাও medico-legal aspects. Medico-legal aspects, you have to memorize all these things. Mainly it is in a commercial use, it is used as like in stain removal, অনেক জায়গায় স্টেন রিমুভাল লন্ড্রি পারপাসে এগুলোতে ব্যবহার করা হয়, ঠিক আছে, as well as it is used in illegally for forgery, ইঙ্ক রিমুভালের কাজ করে, ঠিক আছে। অ্যাক্সিডেন্টাল পয়জনিং হতে পারে, মিস্টেক বাচ্চাদের ক্ষেত্রে হয়। সুইসাইডাল নট কমন অ্যান্ড হোমিসাইডাল রেয়ার, মানে নট হয় না, যদি ইন কেস if it is readily available one may consume, but normally accidentally হয়, হতে পারে না হতে পারে। homicidal it is rare and abortifacient also rare, okay। so another feature is oxalates, যেটা আমরা বললাম ইউরিনে ডিটেক্ট করছি, so oxalates can be naturally মানে normally can be found in urine, ঠিক আছে, এই না যে পয়জনিংই হয়েছে। So in which cases oxalate naturally occurs is যদি if in cases of consumption of vegetables like cabbage, rhubarb and all, they contains oxalate, ঠিক আছে, so that will be excreted in urine normally, that is not poisoning, okay। so it is about 20 gram in 24 hours, fine, so it may be found naturally also in urine। Now coming to the treatment part. Treatment part is are different than the regular corrosives. Mineral থেকে একটু আলাদা। So here MSCs can be done. Now coming to the whether gastric lavage can be done or not. Okay. Corrosives এ একটা contraindication আছে, gastric lavage করা যাবে কি করা যাবে না। Okay. So thing is that the answer will be when it comes to mineral acid, mineral corrosives, it should not be done. Ekdom absolute contraindication. When it comes to oxalic or carbolic, it can be done with caution, precaution niye, because here the local action is relatively less. Okay, so benefit ratio jeta dekha jay, beneficial is more. So how will you decide whether to what you got gastric lavage korbo ki na? So it depends upon the severity. So normally we do a fibro optic endoscopy, okay, to see what is the damage, okay, and then we can put Ryle's tube or gastric lavage, we can do it. So in that cover, so in emergency basis say you will not do gastric lavage, opore giye korbe, ICU te admit hoye gelo, sekhane available থাকলো যেটা আমাদের ফাইব্রোঅপটিক গ্যাস্ট্রোস্কোপি কিংবা তোমার গ্যাস্ট্রোএন্টারোলজিস্ট থাকলো, they will do it. Emergency, don't try to do gastric lavage in this corrosives. Okay, so stomach wash can be given cautiously, so the term has mentioned cautiously, ঠিক আছে? So caution টা কি, যেটা বললাম, if you have fiberoptic gastroscopy available without, ঠিক আছে, এন্ডোস্কোপি অ্যাভেলেবল থাকলে তবে গিয়ে করবে, দ্যাট ইজ দি কশন, ঠিক আছে? সো ইফ এভরিথিং ইজ ফাইন, যে দেখছো যে সেরকম ড্যামেজ হয়নি, অল্প খেয়েছিল, সেরকম ইসোফেগাস ইজ অলরাইট, ইট ক্যান হ্যান্ডেল দি পাইপ অ্যান্ড গ্যাস্ট্রিক লাভাজ ক্যান বি ডান, তখন we can instill calcium lactate or gluconate, calcium. So here the antidote is calcium. Anything that has calcium in it, it will act as an antidote. So again I am stating that it reacts with calcium to form calcium oxalate, and that it gets deposited in tissues. So why again I am giving calcium? So calcium is insoluble, আর এটা আমরা orally দিচ্ছি, ঠিক আছে? So here we, along with it, we give IV 5D solution, ঠিক আছে? 5D মানে glucose dextrose solution, ঠিক আছে? So it can pass away, fine. And then we can use demulcent drinks, okay? Anemia can be given, and hypocalcemia should be corrected with IV calcium gluconate solution, okay, 10%. And other symptomatic treatment. তাহলে এখানে what is the things absolutely you should mention? Calcium as an antidote, okay, in treatment part. Whereas in signs and symptoms, oxaluria, hypocalcemia, and আরেকটা কি ছিল? spasm, ওটাকে hypocalcemia তে চলে এলো। Now coming to the one more important part, that is PM findings. PM findings, calcium oxalate, this there will be black streaks in the form of network. Stomach এর নিচে, mucous membrane এর নিচে যে vessels গুলো যায় stomach এ, there will be black streaks that will appear in the stomach. So this is a typical finding we find in post-mortem, ঠিক আছে? The blood vessels under the mucous membrane appears dark brown or black streaks in the form of networks due to deposition of calcium oxalate crystals. Eta খুব important. So examiner will ask you till he gets this line out of you, and if you fail to provide so, then it will be again kete kute golla, okay? So that is a calcium oxalate, যেটা বলছে it will get deposited, right? So blood vessel এ যখন ডিপোজিট হচ্ছে, যে স্টমাকের যে মিউকাস মেমব্রেনের নিচে there will be black streaks, যেটা এখানে বলছে যে dark brown or black streaks in the form of network, ঠিক আছে, due to deposition of calcium oxalate crystals. স্টমাকের ফাইন্ডিং টা fine, and rest it is almost similar with other corrosives, ঠিক আছে? corrosion in mouth, throat, esophagus and stomach, এগুলো কমন সব কিছুতে। Then there will be dark brown grumous liquid, it is also common in all poisons, but the differentiating factor is that this line that has been underlined. বোঝা গেল? And in kidneys there will be sign of renal failure. There will be pale cortex, dusky medulla. Okay, pale cortex and dusky medulla. That is sign of renal failure. Those things we will find. All right. So this completes the oxalic acid. বোঝা গেল কি কি লিখতে হবে, কি কি ইম্পর্টেন্ট পয়েন্টস কোথায় স্ট্রেস করতে হবে। Carbolic acid. So time is up. Carbolic acid will continue in practical class. Okay, because 10 o'clock এটা শেষ করতে আরো 10 মিনিট সময় লাগবে, will be due. Fine. So carbolic acid is left and alkalis is left. Alkalis and carbolic acid একসঙ্গে করিয়ে দেবো। আলকালিতে বেশি কিছু না, it is common. Ammonia and sodium সোডিয়ামের যে কিছু কয়েকটা ভেরিয়েন্ট আছে alkalis, সব সেম আছে। It is same as corrosives. Okay, treatment also same, everything is same. So alkalis in exam it will appear rarely, acids দেওয়া হয়, but still you should know. So alkalis এর একটা ইম্পর্টেন্ট পয়েন্ট আছে যেটা বলে দিচ্ছি। Alkalis causes what type of necrosis? Liquefactive necrosis. Here it was coagulative necrosis, acidic. So that is the part, and in alkalis the damage will be more. Damage to the tissues are more in alkalis because the penetration power of the alkalis are more. এখানে কি হচ্ছে, acid when it comes in contact with tissue, it intensity reduces in acids, but in alkalis the intensity doesn't reduce, ওটা ওরকমই থাকে। It will cause damage to the tissues, proteins and all, and in fat tissue saponification it will cause. Okay, so the term saponification, liquefactive necrosis, these things examiner will try to listen but get from you, ওইগুলো শুনতে ভালোবাসবে। ঠিক আছে, liquefactive necrosis, saponification,